A 74-year-old retired librarian named Patricia believed she had done everything right. She had Medicare, she had a supplement plan, she had saved carefully for 31 years. When she was hospitalized after a serious fall, she assumed her coverage would handle whatever came next. 3 months later, Patricia was sitting at her kitchen table in Tucson, Arizona, withdrawing money from the retirement account she had spent her entire working life building. The bills had arrived in waves, from the hospital, from the rehabilitation facility, from specialists she had never chosen and barely remembered meeting. Each one carried a balance she had never expected and could not explain. Her daughter flew in from out of state to help sort through the paperwork. She found notices that had never been opened, forms that had been signed without being read, and deadlines that had quietly passed without anyone in the family knowing they existed for anyone. Patricia told her daughter, "I thought Medicare covered me. I thought I was safe. Nobody ever sat me down and explained what Medicare actually does and does not do. Nobody told me there were rules I could break without even knowing they existed." If you are on Medicare, or if you are approaching Medicare age, or if you have a parent who depends on Medicare for their health and financial security, what you are about to hear could save your family thousands of dollars, prevent mistakes that cannot be undone, and give you the specific knowledge that most seniors only gain the hard way. Today we are going through the 5 most expensive Medicare mistakes that seniors make every year. For each one, you will learn exactly why it happens, exactly what it costs, and the exact words and actions that can protect you right now. We are counting down from 5 to 1. Stay with me all the way to the end, because the number 1 mistake on this list is one that affects nearly every Medicare beneficiary in America, and most of them have no idea it is happening to them. Let us start. The first mistake costs seniors more in a single year than almost any other misunderstanding about Medicare, and it begins with a belief that feels completely reasonable. Most seniors believe that Medicare will cover their nursing home stay if they need one. They have paid into Medicare for decades. They have seen advertisements for Medicare Advantage plans that emphasize comprehensive coverage. They assume that if something serious happens and they need long-term care, Medicare will be there. Here is the truth that Medicare itself does not advertise loudly enough. Medicare does not cover long-term nursing home care, not for a year, not for 6 months, not in the way most people imagine. Medicare covers skilled nursing facility care only under very specific conditions, and only for a limited time. You must have had a qualifying inpatient hospital stay of at least 3 days. The nursing facility must be Medicare certified, and the care you need must be skilled care, meaning it requires the services of a licensed nurse or therapist. Even then, Medicare only covers the full cost for the first 20 days. From day 21 through day 100, there is a significant daily copayment, currently over $200 per day. After 100 days, Medicare coverage ends completely. For seniors who need ongoing care beyond that point, and many do, the cost falls entirely on them. The average private nursing home room in the United States now costs over $9,000 per month. 1 year of care can exceed $100,000. Most families discover this reality not when they are planning, they discover it when the bill arrives. Eugene was 81 years old, a retired electrician from Cleveland, Ohio. He had a stroke that left him needing significant rehabilitation and ongoing care. His wife, who had managed their finances carefully for 53 years, assumed Medicare would cover his nursing home stay for as long as he needed it. She had heard the phrase Medicare covers skilled nursing and believed that meant they were protected. After 100 days, the Medicare coverage ended. The nursing facility continued at full private pay rates. Eugene's wife spent through their joint savings in less than 8 months. She was eventually forced to sell the home they had lived in for 40 years to continue paying for his care. She said, "I never knew there was a limit. Nobody told me there was a day 100. I thought Medicare meant we were taken care of." Here is what you need to do right now. Pull out your Medicare and You handbook, the annual guide Medicare mails to every beneficiary, and look up skilled nursing facility coverage. Read the day-by-day breakdown. Understand exactly where your coverage ends. Then say these words to your doctor or Medicare counselor. Say, I want to understand exactly what Medicare covers for skilled nursing care, what my daily costs will be after day 20, and what options exist for covering long-term care costs beyond what Medicare provides. Also contact your state health insurance assistance program, known as SHIP, for free, unbiased counseling. Every state has one. The counselors are trained specifically to help Medicare beneficiaries understand exactly what their coverage does and does not include. The call is free. The information could save your family more than you can imagine. Most seniors never have this conversation until they are already inside a nursing home. By then, the options are far more limited. But the nursing home trap, as painful as it is, still gives you time to plan if you catch it early. The next mistake has a deadline, and once that deadline passes, the financial penalty follows you for the rest of your life. Most people know that Medicare has enrollment periods. What most people do not know is how rigid those periods are and how severe the consequences are for missing them. Here is what happens. Medicare Part B, which covers doctor visits, outpatient care, and many medical services, has a late enrollment penalty that adds 10% to your premium for every 12-month period you were eligible but did not enroll. That penalty is not temporary. It is permanent. It follows you for as long as you have Medicare Part B. Medicare Part D, prescription drug coverage, has a similar late enrollment penalty of 1% per month for every month you went without creditable drug coverage, also permanent. And Medicare supplement plans, the plans that help cover what Medicare does not, can deny coverage or charge higher premiums based on health conditions if you miss your initial open enrollment window, which opens the month you turn 65 and are enrolled in Part B and lasts for 6 months. After that window closes, in most states, insurers can reject your application or charge you more based on your health history. These penalties and restrictions exist in a system that most people are not taught to navigate, and the consequences of missing a deadline by even a few months can cost thousands of dollars over a lifetime. Sandra was 67 years old, a retired restaurant owner from Austin, Texas. She had retired at 63 and remained on her husband's employer health plan, which she believed counted as creditable coverage for Medicare purposes. When her husband retired at 68, Sandra assumed she had time to enroll in Medicare within a standard window. What Sandra did not know was that the rules for enrolling after leaving employer coverage have specific requirements and timelines that her situation did not cleanly fit. She missed her special enrollment period by 4 months. The result was a late enrollment penalty on her Part B premium that will cost her an additional $340 every single year for the rest of her life. And because her Medigap open enrollment window had also closed, she was unable to obtain a Medicare supplement plan without medical underwriting. Due to a pre-existing condition, she was denied. Sandra said, "I thought I was being responsible by staying on my husband's plan. I did not know there was a clock running that I could not see." Here is what you need to do immediately if you are approaching 65 or if you are already on Medicare and unsure whether you enrolled on time. Contact the Social Security Administration directly and ask them to confirm your Medicare enrollment dates and whether any late enrollment penalties have been applied to your account. I want to confirm my Medicare Part B and Part D enrollment dates, whether I have any late enrollment penalties on my account, and whether I am still within any special enrollment period based on my current coverage situation. That conversation takes less than 30 minutes, and the information it gives you could prevent a permanent financial penalty that follows you for decades. Most seniors who pay late enrollment penalties had no idea they were incurring them until it was already too late to stop. Do not let that be you. But enrollment mistakes, as costly as they are, happen once. The next mistake happens every single year, and most seniors make it without realizing there was anything to decide. Every year, from October 15th through December 7th, Medicare holds its annual open enrollment period. During this time, every Medicare beneficiary has the right to review their current coverage and make changes that take effect on January 1st of the following year. This is not a formality. This is one of the most important financial reviews a senior can conduct every single year, because Medicare plans change every year. The plan that covered your medications last year may have moved those medications to a higher tier this year, meaning you will pay significantly more for the same prescriptions. Your Medicare Advantage plan may have changed its network of doctors, meaning your primary care physician or your specialist may no longer be covered in-network. Your premium may have increased. Your annual deductible may have changed. Your out-of-pocket maximum may have shifted. These changes are disclosed every year in a document called the Annual Notice of Change, which your plan is required to mail to you before October 15th. Most seniors receive this document, see that it is dense and detailed, and set it aside without reading it. And then January 1st arrives, and everything has changed, and they do not know why their bills look different. Harold was 72 years old, a retired teacher from Minneapolis, Minnesota. He had been on the same Medicare Advantage plan for 4 years and was satisfied with his coverage. Every fall, he received the Annual Notice of Change and set it aside. He trusted that the plan would remain roughly the same. In January of the following year, Harold discovered that 3 of his regular medications had been moved to a higher formulary tier. His monthly drug costs increased by over $230. Additionally, the specialist he had seen for a chronic condition for 6 years was no longer in his plan's network. Switching to a new specialist meant starting over. New referrals, new records, new waiting periods. Over the course of that year, Harold paid nearly $3,000 more than he had paid the year before, for coverage that, on the surface, looked identical. His daughter said he did not know the plan had changed. Nobody called him to explain it. It was in a document he never read. Here is what you need to do every single fall without exception. When your annual notice of change arrives, read the sections on formulary changes, network changes, and premium and cost-sharing changes. Then go to Medicare.gov and use the Plan Finder tool to compare your current plan against other available plans in your area based on your specific medications and doctors. Say these words to a SHIP counselor or Medicare advisor during open enrollment. Say, I want to compare my current plan's coverage for my specific medications and my specific doctors against every other plan available in my zip code for next year. That comparison, done every single year, has saved seniors hundreds and sometimes thousands of dollars annually. It takes one phone call. It is completely free, and most seniors never make it. The next mistake is one that costs seniors money they are already owed, and the painful part is that walking away from it requires nothing more than a letter. When Medicare denies a claim, when it decides it will not pay for a service, a medication, a procedure, or a stay, most seniors accept that denial as final. They receive an explanation of benefits, showing that a charge was denied. They feel overwhelmed by the appeals process, and they assume that Medicare's decision cannot be changed. That assumption is wrong, and it is costing Medicare beneficiaries billions of dollars every year. Medicare denials are overturned at remarkably high rates when beneficiaries appeal them. Studies have shown that a significant percentage of appealed Medicare decisions are reversed in favor of the beneficiary, particularly at higher levels of appeal. And the appeals process is free. It does not require a lawyer. It does not require special knowledge. It requires a letter and a deadline. When Medicare denies a claim, you receive a document called a Medicare Summary Notice if you have Original Medicare, or an explanation of benefits if you have a Medicare Advantage plan. That document contains your right to appeal and the deadline for doing so. In most cases, you have 120 days to file a first-level appeal, called a redetermination. Most seniors never file that appeal, not because they do not want to, but because the paperwork looks complicated. The deadline feels far away, and nobody ever told them that the denial was not necessarily the final answer. Lorraine was 69 years old, a retired social worker from Richmond, Virginia. Her Medicare Advantage plan denied coverage for a procedure her physician had determined was medically necessary for a condition that had been affecting her quality of life for over 2 years. The denial letter used language about medical necessity criteria that Lorraine did not understand. She called her plan's customer service line. The representative confirmed the denial. Lorraine assumed the decision was final, and began exploring how to pay for the procedure out of pocket. The cost was $11,000. Her granddaughter, who worked in healthcare administration, visited 2 weeks later and immediately recognized that the denial was worth appealing. She helped Lorraine file a redetermination request with supporting documentation from Lorraine's physician. The denial was overturned within 30 days. Medicare covered the procedure. Lorraine said, "I almost paid $11,000 because I did not know I could write a letter." When you receive any Medicare denial, say these words before accepting it. Say, "I want to formally appeal this denial. Please provide me with the specific criteria that were used to deny this claim and the deadline for filing a redetermination request." Then, contact your physician and ask them to write a letter of medical necessity supporting your appeal. That combination, your formal appeal request and your physician's documentation, is the foundation of a successful appeal at every level of the Medicare process. Do not accept a denial as the final word. In Medicare, the first no is often not the last answer. Have you ever received a Medicare bill or denial you did not expect? Tell us in the comments. Your experience could help another senior know what to do before their deadline passes. Now we have reached the mistake that underlies every other mistake on this list. The mistake that creates the gap between what seniors believe Medicare does and what Medicare actually does. The mistake that leaves families unprepared, unprotected, and financially vulnerable at the moment in life when they can least afford to be. It is the belief that Medicare covers everything. Not everything expensive, not everything serious, everything. Medicare is an extraordinary program. It covers hospitalizations, it covers physician visits, it covers many preventative services. It has improved and extended the lives of tens of millions of Americans. But it has gaps, significant, expensive, life-altering gaps. And most Medicare beneficiaries do not know where those gaps are until they fall through one. Medicare does not cover most dental care. Millions of seniors cannot afford dental treatment and go without it, leading to serious health complications that ultimately cost far more to treat. Medicare does not cover routine vision care or eyeglasses. Seniors with deteriorating vision who cannot afford out-of-pocket eye care lose independence and quality of life that no supplement can restore. Medicare does not cover most hearing aids. The average cost of a pair of hearing aids is between $3,000 and $7,000. Many seniors simply go without them. The cognitive and social consequences of untreated hearing loss are devastating. Medicare does not cap your out-of-pocket costs for hospital care under Original Medicare. There is no out-of-pocket maximum. A catastrophic illness could result in unlimited personal financial exposure. Medicare does not cover care received outside the United States in most circumstances. Seniors who travel, who spend time abroad, who have family in other countries have no Medicare coverage beyond American borders. These are not obscure exceptions. These are central realities of a program that 60 million Americans depend on for their health and financial security, and most of them do not know these gaps exist until something happens. Vincent was 78 years old, a retired architect from Charleston, South Carolina. He had been on Medicare for 13 years and believed he was well covered. He had never purchased a Medicare supplement plan because he felt his Medicare Advantage plan was comprehensive. Over the course of a single year, Vincent required a hearing evaluation and hearing aids. Not covered. He needed a dental procedure following an infection. Not covered. He spent 3 weeks outside the country visiting family and required a physician visit for a respiratory infection. Not covered. And he was hospitalized twice for a cardiac condition that resulted in out-of-pocket costs that his Advantage plan's cost-sharing structure made significant. By the end of that year, Vincent had spent over $14,000 out of pocket on healthcare costs that he had believed, in general terms, that Medicare covered. His son said, "My father was not careless. He was not uninformed. He just believed that Medicare meant covered. He did not know the difference between covered in theory and covered in practice." Here is what every Medicare beneficiary needs to do. Sit down, today, not someday, with your Medicare and You handbook, your current plan documents, and a list of your regular healthcare needs. Go through that list line by line and ask one question about each item. Does my current Medicare coverage pay for this? And if so, how much do I pay out of pocket? Then contact your SHIP counselor, again, completely free in every state, and say these words. Say, I want to review my current Medicare coverage against my actual healthcare needs and identify every gap where I may face significant out-of-pocket costs. I want to understand whether a Medigap supplement, a different Advantage plan, or additional coverage would better protect me given my specific situation. That review, done thoroughly and honestly, is the most important financial planning conversation a Medicare beneficiary can have, and most seniors never have it. Not because they do not care, but because nobody ever told them it was necessary. You now know it is necessary, and you now know what to ask. Before we close, here is your Medicare protection plan, the exact steps and exact words that can protect your health and your retirement savings, starting today. For nursing home coverage, say, I want to understand exactly what Medicare covers for skilled nursing care, what my daily costs will be after day 20, and what options exist for long-term care costs beyond what Medicare provides. For enrollment deadlines, say, I want to confirm my Medicare Part B and Part D enrollment dates, whether I have any late enrollment penalties, and whether I am still within any special enrollment period. For annual plan changes, say, I want to compare my current plan's coverage for my specific medications and doctors against every other plan available in my zip code. For Medicare denials, say, I want to formally appeal this denial. Please provide me with the specific criteria used to deny this claim and the deadline for filing a redetermination request. For coverage gaps, say, I want to review my current Medicare coverage against my actual healthcare needs and identify every gap where I may face significant out-of-pocket costs. Write these down, save them in your phone, share them with the people you love. Because the Medicare system is complex, it changes every year, and the cost of not understanding it falls entirely on you. You are not powerless inside this system. You are a beneficiary with rights, with options, and now with the knowledge to use both. If videos like this help you protect your health, your finances, and your future, please subscribe and join us. We are here every week because this information matters and because you deserve to have it. Because in our next video, we are exposing the hospital billing trap that is quietly costing seniors thousands of dollars. Not through fraud, not through error, but through a billing practice that is completely legal, almost never explained, and almost always avoidable once you know exactly what to look for. You will not want to miss it.